Hi, I'm Billy Woodard. I'm the Executive Director of the Smith County Chamber of Commerce, and we have a guest with us here today, Mr. Michael Herman. Michael, would you introduce yourself to the folks?
Absolutely. Again, my name is Mike Herman. I'm the Chief Executive Officer of Riverview Regional Medical Center. I've been here for just over 4 years now. Love this community, love this hospital, and excited to get to spend some time with you today, Mr. Woodard.
Well, thank you for coming. We're going to talk to you about 3 or 4 things today. Number one, healthcare in the region. Number 2, healthcare specifically in Smith County and specifically related to Riverview Regional. Then thirdly, the COVID-19 pandemic that we're going through right now and our response to that. And then we'll follow up with maybe some recommendations that we would have for you folks out there that are going through this as we all are. And first thing I'm going to talk about, Michael, you may want to address this. We in Smith County are very blessed to have Riverview Regional here with us. Many of our surrounding counties do not have hospital facilities or even medical facilities. Would you comment on that? Because I know you'd have a better idea than I do.
Absolutely. You hit the nail on the head. Hospitals in rural America are struggling right now. And several hospitals have closed in our state, and hundreds have closed across the country over the last 5-10 years. So we are fortunate within Smith County to have a very strong hospital. Financially, we are viable, and we are part of LifePoint Health, which owns 88 hospitals across the country. And with that comes resources and expertise that standalone hospitals and small communities just don't receive. And the backbone of the great care we provide is from our physicians, from our local physicians, our primary care physicians, to our surgeons that are here local. And then we have specialists that come from Cookeville, that come from Nashville, to help support this community in special care needs also. So as a small community hospital, we provide a lot more services than most community hospitals. We have a very busy orthopedic surgeon who is here all throughout the week providing care to our community. We have a general surgeon providing care to our community. Doing OB in a small community hospital is unique in this day and age. And we have a very strong OB program and a growing OB program. Our births year over year have been continuing to grow. We have a great new physician, Dr. Burgess, who is doing wonderful in the OB portion of our hospital, and she's learning under Dr. Rutherford, who's been here forever, and it has generational knowledge on our community, our hospital, and clinical care that is top-notch.
Right. Well, now you kind of segued into what was going on here, but getting back to the region, if you look at the region, I guess Putnam County, there's another regional hospital there, and then of course in Wilson County, which touches us. Mm-hmm. And so if there is something that gets to a level that you feel you would rather someone, how do you decide who stays and who goes, or is that a valid question?
It's always a valid question because there's some things that we just can't do because of our size. My recommendation globally is if you're in an emergency situation, come visit our ER. We can stabilize you. We have a physician there 24/7 who is ready, willing, and able to assess you in your emergency and get you to the right location. So if you're having a heart attack and you need an intervention, we can help facilitate that as quickly as possible, but we'll also stabilize you more quickly than driving past our hospital to get to an interventional site.
Okay, say a person gets in a trouble some way, whatever it may be. Mm-hmm. Of course, we have a local EMS
right.
That work very closely with you.
Yep.
Many times they will take a person to another hospital if they request, but most of the time, I think if there's something going on in the county, they bring them to you guys. And then you do exactly what you said. You stabilize them and decide if you can work with them or there. I personally have had experience with this, mm-hmm. And with me and my wife, and I've always appreciated the fact that my wife was in a pretty serious situation a few years back, and we came into Riverview Regional, and the doctor came in and he says, this is something that needs to be handled at a surgical center more than what we have here, and then they gave us the choices.
Right.
And then, of course, stabilized, sent there, and her outcome was great. I presume that there's a lot of stories like that.
Absolutely, and we have a great relationship with EMS. Our EMS staff are the experts out in the field on what's going on with our patients. So you are absolutely right. You know, they, outside of patient preference, they generally come to us so we can get that patient treatment as quickly as possible, get them stabilized, and get them to the right location of care if it's not with us.
Okay, in the days gone by, I'll use it that way, people used to come and stay at the hospital quite a bit. It seems to be more of an outpatient thing now, and people not staying at the hospital anymore. Is that the case? Have I described it pretty close?
Yeah, absolutely. There used to be a day when you came into the hospital and rested for several days before you had surgery. That has changed globally. Every hospital in the country is reducing your length of stay in the hospital to get you healthy, but to get you in your home environment to heal. There is something that is intangible in allowing you to be home in your own bed with your family when it's clinically safe. And we've discovered over the years that reducing the amount of time in the hospital and getting a patient home to their home environment when it's clinically appropriate actually accelerates some of the healing processes.
Right. And of course, we're going to talk about COVID-19 and the pandemic we're in a little bit later. And that's why you and I are wearing the mask. You made a comment about the mask. You said, if it's important to me and I'm requiring my staff to do it, then I need to set the example, and that obviously is why you have the mask on during the interview.
Absolutely.
And we're going to get into that a little bit later.
Okay.
We talked about Riverview and LifePoint. What are some of the services that you offer in conjunction? I know there are several nurse practitioners and doctors here in the area.
Yep.
And you guys work with them. How is that coordinated? How does that work?
It's our local physicians. We have a mix of people who have been employed by the hospital, and they're employees of the hospital, and then we have some independent physicians within the community. We have mid-levels that help with primary care, and then we've got our physicians that also are primary care focused physicians. So we have a good complement across both Carthage and Gordonsville of providers, and then we have a few specialists who come from outside the region to support our area. So specifically cardiology, we have a very strong cardiology presence in our specialty clinic. Along with nephrology, we have a very, very good nephrologist who comes there with regularity. An endocrinologist, which that's unique in our environment to have endocrinology in our community. That's a specialty that doesn't have a lot of providers, and the fact that we have one that comes here every other week is representative of how this community is growing and how the health of our community is important to our organization, that we've been able to encourage those physicians to come and spend time with us to help our community out.
Okay, well, the synergy between you and all these providers, they of course feed to you, and they use hospital services.
Absolutely.
Back and forth. I know a lot of the tests. I go to a particular practitioner here, and I know a lot of the testing is done there at the hospital, and the results come back. So I realize they use that. Is there anything that I haven't asked about that we need to, like physical therapy can be done locally? You have a physical therapy department. I know I've used it. Is there anything I'm missing about the particular Riverview Regional that we need to mention?
Absolutely. So to touch on physical therapy, we have lymphedema therapist, we have a pelvic floor therapist certified. We anticipate to be certified in dry needling soon. So to your point, there's a ton going on at Riverview that our community may not be aware of. One service that we haven't touched on is our Jerry Psych service. And that's for our elderly population who is having behavioral challenges. And generally speaking, sometimes meds start interacting with our geriatric population and their behaviors start getting out of whack a little bit. If it's very acute, we can bring them as an inpatient and get their meds lined up relatively quickly. If it's not that serious, we have an outpatient program called Senior Life Solutions that is focused on our geriatric population, on depressed and anxiety patients or people experiencing anxiety. And I've heard great stories of our geriatric population, individuals going from barely engaged in life to living life to its fullest with the outpatient program and the therapy. That started in June, and I'm very excited that we get to provide that service locally. The psychiatrist is from Vanderbilt. He does a wonderful job. Our therapists are well trained, and the programs run really, really well. So that will be an added service that started this past month that I feel will improve the health of our community, which is our mission.
Exactly. I know at one time you guys were doing sleep studies. Is that still or is that moved to one of your other sites?
That unfortunately that has moved to Sumner, and that program and that service has gone to a home-based model primarily. Insurance companies like the initial sleep study to be home-based, and then if there's a significant need, do on-site at the hospital. When I was looking at the service, it wasn't utilized a ton here locally. And that's the space I'm using for the Senior Life Solutions program.
Okay, and that you bring up a good point that we haven't touched on and we need to address. There are a lot of things that are being done home-based, and a lot of things that are happening at a person's home that would not have been considered just a few decades ago or a few years ago. And that, of course, is one of them, and that's because of the monitoring you can do now.
Absolutely.
With electronics and stuff.
Yeah.
I know the EMS trucks, they're actually in touch with a doctor if they need to be on the EMS.
A good example there is they'll transmit an EKG to the ER before they arrive in the ER. So technology is another reason why we're spending less time in the hospital, doing more at home, and doing more on an outpatient basis, because the technology continues to get better and better. And COVID-19 has accelerated telemedicine. We are probably 2 years ahead of where we would be without COVID-19 because telemedicine has proved to be an effective way to treat patients and maintain social distance, maintain isolation, maintain safety from transmitting COVID-19. So that's a silver lining of the last few months.
Okay, well, get to one basic thing that affects a lot of people around here, and then we'll move on to the COVID-19. How is your visitors policy and things like that at the hospital now under this general climate?
Right. Unfortunately, we've had to limit visitation for the safety of our employees and patients. It's a very difficult decision to make because on one hand, we fully recognize how having your family present with you while you're receiving care is incredibly important. But unfortunately, in our present situation with PPE supplies being limited and the transmission of this disease being so pervasive, we have limited our visitors to certain scenarios. So we recognize end-of-life scenarios will obviously allow visitors for end of life. Outpatient procedures where the patient needs somebody to help get them home, get them out of the hospital, that's completely appropriate. And then we have some exceptions on down the road for a few other areas, but we are limiting visitors because to reduce the number of people who are coming in and through our hospital.
So a person needs to have a very valid and compelling reason to even come to the hospital right now, whereas before it was just basically you could walk in and
Absolutely. We used to have several community members a day come into our cafeteria to eat lunch because it was easy, convenient, and cheap. And unfortunately, we've had to eliminate that to the same point of just reducing the number of people coming through.
Right, I've ate lunch there several times. By the way, good food too.
Thank you. Thank you.
Okay, talking about COVID-19 and the response here in the county, one of the things that prompted me to even give you the call about talking about this, the Smith County Coronavirus Task Force, which Dr. Roger Duke is heading up for the mayor, him and Mayor Mason. They shared some statistics with us, and in a 28-day period, we were just right on the threshold line, which it means that you're doing okay. You got some cases, but you're doing okay. Currently, the past 28 days, we've seen spikes on different days. It comes down, it spikes, and then here is one spike that it took us up to where we are in the almost 200 range, and at this airing it may be more than that. Right. It seems to me that COVID-19 is going to be with us for a while. What do you think should be our response for this?
Yes, COVID-19 is definitely going to be with us for a while. And Smith County did a very good job in the initial phase of limiting the transmission of this disease. The graph you're referring to absolutely demonstrates how we as a community protected each other very well. Unfortunately, we can only shut down our economy and shut down our daily habits and behaviors for only so long. What the graph represents now is getting back to normal life and the impact of the disease spreading. So yes, it will be with us. My biggest encouragement is for our community to wear masks when they're out and about. That has proven, HHS has proven that reduces transmission. We're also, since the beginning, we're doing more testing. And we have the availability of testing has gone significantly up. We are learning that 30 to 50% of the people who test positive are asymptomatic or have no symptoms. And so there's a group in those numbers in that graph that represent people who don't feel bad. And unfortunately, when you don't feel bad, you don't wear a mask, you interact with people as you normally do, and could inadvertently transmit the disease. So that's what we're seeing now. When I talk to my peers and listen to my physicians, we think the fall could see another surge up and see continued spread of the virus. And so that's a little concerning, but at the same time, that gives us more time to learn how to treat the disease, more time to produce PPE to keep ourselves safe. And the goal at the beginning was to flatten the curve. I think the term everybody heard was flatten the curve, and we definitely did that at the beginning. And we're coming up now, and we're pushing up against the healthcare's capacity, particularly in the urban areas. The bigger hospitals are starting to push against their capacity for treating COVID patients. But we're barely keeping our eyes above water right now. And as long as we continue to keep our eyes above water, we'll survive the short-term future of COVID. So.
Okay, well, the virus itself, I know if you watch the news, they basically are saying it's probably not going to go away. It's going to be with us for a while. Even if we get a vaccine, it'll help us control it, but it's probably here to stay. Eradication is a dream, but maybe just that.
Right.
as far as here locally, like you say, we've flattened the curve, and now we're starting to see it come up.
Yes.
In the fall, why do you feel like that? Is it because people will be indoors more, or is there another reason?
People indoors more. It's a theory at this point is that it'll follow some of the behaviors of the flu, as far as being more prevalent in the fall, winter, springtime. And then also it's complicated by getting back to school, getting back to fall sporting events, and all the social interaction that happens with those items that we're all looking forward to. We all miss school, we all miss football, we all miss sporting activities. And so the combination of the change in weather and then increasing in getting back to whatever our new normal is why I think the fall we'll see another uptick in the curve.
Okay, well, on the back of this flyer that we produced, it shows why wear a mask, and it's got two people without it, one healthy, one infected, and it says little protection. Then you have one wearing a mask, one not that's healthy, and it says some protection. And then it has both of them wearing a mask, one healthy, one infected, and it says better protection. And then if they're both wearing a mask and 6 feet apart, it's the best protection that you can have. It's unfortunate that in some areas the wearing of the mask has been politicized, and sometimes some even other reasons that people would use for either wearing or not wearing a mask, but it's just simply a scientific thing. This is a respiratory virus.
Right.
And if you're breathing in that heavy breath that you've got that's laden with the water is kept in the mask, it doesn't get out to infect another person. It's as simple as that. Am I correct?
You are correct. You said it perfect. And that's why throughout our conversation, I've been talking about the importance of wearing a mask. And that goes for every aspect of life. It goes for when you're out in the grocery store and doing life. Wearing a mask for now, at this point in time, is the right thing to do.
Okay, and I noticed, I don't know at the time of the airing or when you watch this video, but Walmart, who is a chamber member, by the way, and Riverview Regional, thank you for being a chamber member.
Welcome.
They are actually requiring a mask if you come in the store.
Yep.
And I think that we're going to see more and more of that as time goes on, as places are going to require that you have a mask on before you come in. And that is obviously to try and ramp down the infection and the spread.
Yep.
Lastly, how is our capacity at our local hospital? Are we in good shape right at the moment? Are we prepared for more cases?
Absolutely. So great question. So yes, we do have capacity at our hospital. As I talked about being part of LifePoint Health, I have 3 sister hospitals that range from Gallatin to Livingston. Right now, my sister hospital in Gallatin, we are trying to isolate all active COVID patients there to keep our hospital operating as usual. To the best of our ability for caring for our patients. So yes, we have capacity. Yes, we are prepared to care for COVID positive patients. So we have our air machines that suck the air out of the building because this is airborne. So if a patient's in a specific room, all the air in that room gets pulled out of the building. And so it doesn't go into another patient's room or go where our staff are located. Your experience at the hospital will be different, as we discussed. Visitation is a little bit different. Everybody wearing a mask will be different. As a patient, you may not see your provider's face like you used to. That's a struggle also. I've joked that I don't hear as well with my mask on. So we're dealing with all those challenges that come with this pace, with this disease. Everybody who comes into our organization is getting screened for symptoms, for temperature, and patients who are having surgery are getting tested for COVID pre-surgery, because during surgery you aerosolize that disease a lot, and so to protect our staff and the patient, we're testing before surgery. And so we have a lot of things in place. Our infection control department and our EVS department are working hand in hand to make sure we clean and sterilize our hospital for everybody, just like we always have, and to make sure that it's a safe and healthy environment for our patients, our staff, and ultimately our community.
Okay, one last thing. I understand that a lot of people are going to face shields for the very reason that you said.
Yes.
Some folks, they've got to see your lips so that they can understand what you're saying, and a lot of people are going to face shields.
Yes.
I am told that those are as effective as the mask. Is that
So we're
correct?
using both. In certain areas where we know we're dealing with positive patients, we're using both the face shield to protect your eyes and mask to protect inhalation. Those face shields are open at the bottom, and you can suck in air that has the disease in it. And that's in the hospital environment. So your eyes, the scientists are learning that ultimately your eyes can start absorbing some of the moisture in the air that you were discussing, and you can contract the virus that way. So that's why you're going to see more of our staff in the hospital wearing face shields. That's partly why you see the plexiglass up everywhere, is it does a combination of the mask and the face shield from an eye protection side. No matter what, it's still better than nothing. But I would encourage, if you're that concerned and you have the goggles or eye protection, wearing both the eye protection and the mask further protects an individual.
Okay, and I know I keep saying one last thing, but I just thought of this. Right now, testing is sometimes a 2-day to 2-week process to get the results. I know there are folks, in fact, there is an industrial customer that is looking to move to Smith County, and they're in the process of developing something along this line. But is there testing that you see that's out there available that can get these results to us quicker than they are now?
Yes, the technology is out there to get it back to us in hours, but the capacity of those machines isn't quite there. And there is some research getting done that has not been FDA approved to get it down to a saliva test versus the nose test. So testing will get better, will get quicker. I do believe it'll get to the point where we are for flu tests, where you can take it in the office and know immediately. It'll get there. It's just time letting the technology develop and validate that it's accurate.
Okay, and that right there alone would be a big factor in stemming the spread of this, would it not?
Absolutely, because then you know for a fact if you're positive or negative.
Right. I have a friend that had quarantined himself for 10 days and it came back negative.
Right.
And he was disappointed, but then he was glad, he didn't have it too. So,
Absolutely.
Okay. Is there anything we're missing that we need to tell people out there in regard to this pandemic?
One last thing. For a little bit there, it became evident that our communities nationwide were delaying care to help flatten the curve and help isolate and those kinds of things. And now we're seeing that don't delay your care just because of the concern of COVID. We all still need our regular PCP visits, our wellness checks. That toothache that's been bothering you, going to the dentist is completely appropriate. Getting your cleanings done is completely appropriate. Getting your mammographies done, those kinds of things. I don't want your health to suffer on one side to protect you from interacting with folks and potentially catching COVID-19. We did see that, and doing it temporarily for a couple months is absolutely understandable. But now we're at that point where don't delay care just because you're concerned about COVID-19.
Okay. Well, Michael, thank you very much for coming by.
No problem. I appreciate the time.
Ladies and gentlemen, this has been a special report from the Smith County Chamber of Commerce. We hope that you will give us a call or give Riverview Regional a call if you've got any questions about anything we've discussed here today. Thank you very much for tuning in.
Appreciate your time.